And I am Diana Chan, Chair of the Whistler Chamber Board of Directors. I would like to acknowledge that we are having this virtual meeting today on the unceded territories of the Squamish Nation and Leewat Nation. As I reflect on the land acknowledgement today, I am grateful that I've had the opportunity to learn from these nations so that I can truly honor their culture, their land, and their traditions, starting from a place of truth. I would like to thank all of our members and sponsors for your continued support of the Chamber, enabling us to do the very important work that we do. Today, we will be learning how to transition from the COVID-19 to communicable disease prevention in the workplace. Now that the province has moved into step 3 of BC's restart plan, employers will no longer be required to maintain the COVID-19 safety plan and will transition to a communicable disease prevention. We are joined today by Chris Back, Director of Occupational Health and Safety Consultation and Education Services at WorkSafeBC, to discuss the fundamental components of a communicable disease prevention. WorkSafeBC's Consultation and Education Services serves the workers and employers of BC by positively influencing health and safety behaviors and disability management practices through partnerships, consultation, and outreach. Chris has been with WorkSafeBC for 6 years. Before moving into the director role, he managed the manufacturing and retail portfolio, as well as the construction portfolio in the consultation and education services. Prior to WorkSafeBC, he held various leadership roles in health and safety and disability management, primarily in the healthcare industry. Chris is a Canadian certified professional ergonomist and holds an MBA from Royal Roads. Chris, welcome, and I'm pleased to invite you to the virtual stage, and I shall turn it over to you.
Thanks, Diana. Appreciate it. And good morning, everyone. I would also like just to take a moment to acknowledge that I live, work, and play on the traditional, ancestral, and unceded territories of the Coast Salish peoples, including the Musqueam, Tsleil-Waututh, and Tsawwassen peoples. It's a great pleasure for me to be here. And look forward to the next hour with all of you. I'll spend probably about 25 to 30 minutes with a brief PowerPoint presentation, and then we can open up for some question and discussion after that. So just bear with me for a sec while I share my screen. And hopefully you can all see that. Should be a title slide that speaks about about transitioning from COVID-19 to communicable disease prevention in the workplace. So as I mentioned, probably about 25 to 30 minutes here as we talk about where we're at today in the restart plan with the BC has put forward, and then really dig into developing a communicable disease prevention plan and what it means to transition from COVID-19 to communicable disease prevention, and hopefully be able to outline how fairly straightforward that transition will be for employers as we go through our recovery out of the pandemic. Talk about some informational resources that are available for all of you as employers and workers in the province, and then we can open it up for some questions afterwards. So to begin with, just a little bit on where we're at today, and I'm not going to spend a lot of time on these slides. I think everyone is fairly familiar with the 4-step plan that the BC government has put forward, and right now we are in the midst of step 3, which began on July 1st. With a gradual loosening of restrictions and protocols. And there was actually quite a significant change for employers between step 2 and step 3. During step 1 and 2, employers were still required to have that COVID-19 safety plan. But as we transitioned into step 3, which again began on July 1st, there was no longer that requirement to have that plan in place. And that came along with a number of other changes that are important for employers to understand. So it goes back actually to a letter that the provincial health officer, Dr. Bonnie Henry, issued on June 17th, where she spoke about this transition from COVID-19 to communicable disease prevention. We'll talk a lot about what that actually means. But another key point within that letter, which can be found on the PHO website if you want to take a look at it, it's a short 2-page letter. But another key point in there was the encouragement from Dr. Henry for employers and the public to maintain existing COVID-19 protocols where they don't negatively interfere with business operations. And that's an important piece, is that going from COVID-19 safety plans to communicable disease prevention doesn't necessarily mean that as of July 1st, you can no longer have your COVID safety plan in place and that you have to get rid of that plan and completely transition over to communicable disease prevention. What you'll find as I speak more about what communicable disease prevention looks like, you'll find that's really just a subset of what was your COVID-19 safety plan. This is probably the first time in my career in health and safety where we've actually talked to employers about taking away health and safety protocols. But you're not forced to do that. You can maintain all of your COVID-19 safety plan protocols if you feel that that's appropriate for your workplace and your particular situation. But moving to step 3 takes away that requirement to have that plan in place, and it allows employers to start to ease off and back off of some of those protocols. However, the recommendation being to maintain those protocols that don't negatively interfere with your business operations, because everyone's going through this transition differently, and maintaining some of those protocols will help with those who might still have some fear that they're going to be exposed to the disease within the workplace. Now, what does that actually mean? Maintaining some of those protocols, it really can mean whatever you want it to mean, other than the requirements, which I'll talk about in a few minutes. But other than that, it's really up to you as the employer. WorkSafeBC and the provincial health office are not going to be arbitrators in which protocols you should keep and which protocols you shouldn't keep. It really does come down to what you feel is appropriate within your business setting and what works for your operations as a business. So examples that Dr. Henry has used is maybe keeping barriers up, where it makes sense to have those plexiglass barriers where it doesn't really impact on business operations. You might want to maintain those barriers. Directional signage might be another one, such as when you go into a grocery store and you see directional signage up and down the aisles to try and create some flow of people. I think there's an assumption that won't necessarily impact business operations. So that might be something that you want to keep in place as well. So those are just some examples of things that you could keep in place, but in the end, it's really up to you as the employer, except for those pieces that are required, which I will get to in a moment. So what does it actually mean? What do we mean when we talk about transitioning from COVID-19 to communicable disease prevention? And really, for those that used our template, WorkSafeBC's template for the COVID-19 safety plan, you will recall that there was a 6-step process. And in fact, when our officers came out and did inspections of workplaces, the expectation was that employers had gone through those 6 steps. So you didn't have to use our template, but there was an expectation you went through those 6 steps. So what we tried to do here in this transition from COVID-19 to communicable disease prevention is maintain that step approach. Now we've gone from 6 steps to 4 steps, and I'll talk about each of those steps as we go through this. But it's important to understand that this again is just meant to be a subset of what you've already had in place for the last year, 15 months. It really talks about basic risk reduction principles to reduce the risk of workplace transmission, not only for COVID-19, but for any communicable disease. That might be, the avian flu, H1N1, influenza, seasonal influenza. Those are all communicable diseases, and the intent here is that the communicable disease prevention plan will encompass all of those. Now, this is really already something that was expected to be in place as part of an overall health and safety program that employers do have, but we've just kind of called it out and outlined it in a little bit more clarity for employers. The other important piece here before I move through each of these steps is that with the COVID-19 safety plan, there was a requirement to have it documented. You had to have it documented. You actually had to have it posted so that anyone coming into the workplace could see what your COVID-19 safety plan was all about. And that would be your workers, any public service providers, anyone else. With communicable disease prevention, there is no requirement to have it documented. It does need to be a part of your occupational and safety program, but depending on how big you are as an employer will dictate how much documentation is required. So there is no requirement to have this plan documented. However, we have recognized through feedback from many employers that documentation actually helps them in communication for their workers, helps to keep it consistent, helps to keep it within policy, helps keep it within their program. So we do have a template on our website that will allow you to document your communicable disease prevention plan as you're putting that together. but just understand that an officer will not be coming out and asking to see a documented plan. They will want to see that you're practicing the components that I'm going to talk about in a moment. So let's walk through each of these steps. Step one is understanding the risk. Now, in COVID-19 safety plan, step one was assessing the risk. And the reason we've changed that terminology is because assessing the risk was around looking at everywhere within your workplace where there might be a possibility of transmitting the disease. We knew the risk was high, and that transmission was very apparent within workplaces. And so you needed to assess where people congregated, where there was a possibility of transmission. Whereas right now, it's not so much assessing the risk, because the risk is actually very low at this point in time. And so employers don't need to go around their workplace and determine where is there a possibility of transmission in the workplace, because the risk is actually significantly lower. But it's around understanding the risk. And what that means in communicable disease prevention is monitoring and reviewing the information that is coming out from the provincial health office, as well as your medical health officers. So any new orders, guidance, notices, recommendations that are being issued by public health at the local, regional, or provincial level. And then where there are protocols being put in place from public health, there is a requirement for employers to follow that guidance. So step one is really just about keeping your ear on the ground and understanding what's going on and staying in tune with any information that's coming out at a regional or provincial level. Now, step two is around implementing controls. And this was a mirror image of what we saw in COVID-19, where step two is around implementing controls. Now, there's two slides that I've got here, and you'll see in the orange text on this one, we talk about ongoing measures, those measures that are required to be in place at all times. And I'm going to come back to this because we're going to focus on those 5 points in a moment. The other piece to step two is additional measures. And those additional measures would be those measures that may need to be implemented as a result of the orders, notices, and guidance being provided by public health or the medical health officers. So there's 2 components to this, and I'm going to go through each in succession. So we'll start with the ongoing measures. And these would be the measures that employers are expected to have in place at all times as part of your communicable disease prevention plan. And what you'll notice throughout all 5 of these is they're fairly straightforward, and they were already requirements within your COVID-19 safety plan, other than maybe the last point, which is specific to vaccinations. But the first one is around policies to support staff with symptoms of any communicable disease. So not just COVID-19, but any communicable disease. And the symptoms of communicable disease are very similar across those various coronaviruses. And this is so that workers are not coming into the workplace when they're sick. So workers should not remain or be permitted to remain in the workplace if they're experiencing any symptoms of communicable disease. Now, I get a lot of questions around, well, what if someone just has allergies or has a common cold? Well, if you actually use the BC CDC guidance on determining the symptoms for communicable disease, they are, if you've got, a runny nose, a sneeze, or a cough, that isn't necessarily enough to indicate that it's communicable disease. We're talking about fever, chills, nausea, diarrhea, other things like that. So we do recommend that you become familiar with BC-CDC's guidance around the signs and symptoms of communicable disease that may lead to the requirement to stay home when sick. The second point is around ensuring that basic hand hygiene facilities are available with appropriate supplies, and reminding employees through policy and signage to wash their hands regularly and to use appropriate hygiene practices. This was already a requirement prior to the pandemic, and it's actually outlined in section 4.85 of the Occupational and Safety Regulation within BC, and it's to ensure that plumbed or portable washroom facilities are readily available and are maintained and kept clean. So that was already a requirement, so really nothing new for employers in that respect. The third point is about maintaining a clean environment through routine cleaning processes that are appropriate for your workplace and your industry. Now, you'll recall during the COVID-19 safety plan era, there was actually guidance coming out from the BC-CDC on how frequent that cleaning should occur. Once a day, twice a day, depending on the environment you worked in. That guidance is really not there anymore, and it is up to the employer to determine what is going to be an appropriate frequency of cleaning based on the industry and the workplace that you operate in. But it is up to you as the employer to maintain a clean environment. Point 4 here is around ensuring that the building's ventilation system is in good operating condition. So it's operating as designed, and that preventative maintenance is being conducted. Again, this was already a requirement prior to the pandemic, and it's outlined in sections 4.70 through 4.80 of the Occupational Health and Safety Regulation related to indoor air quality. And these sections of the regulation require ventilation systems to be properly balanced, which means verifying that the system meets its design conditions for airflow, temperature, humidity, and other design parameters. And a lot of employers, we get questions here too. It's like, well, I just rent the space. I don't know really anything about our ventilation system. It is your responsibility as the employer to ensure that the ventilation system is operating properly. Now, depending on the relationship you have with your landlord, that may or may not be your responsibility under contract. It may be your landlord's responsibility to ensure that the ventilation system is operating and to do the maintenance and to have it regularly checked. But you as the employer need to ensure that that is actually happening. So it's to a certain extent joint responsibility in those types of contractual situations on the land that or the building and the permit and contract that you have in place. The last point is around supporting employees in receiving vaccinations. Now, notice that we don't use the terminology to say mandating vaccinations or putting policies in place to require vaccinations. I'll speak about that actually in a moment. This is around supporting workers to receive vaccinations for COVID-19 and other vaccine preventable illnesses. So, helping to encourage staff to get vaccinated, communicating with staff, talking to staff about it, giving them the appropriate time off to be able to go get your vaccines. But then again, we get a lot of questions around, well, can I have a policy in place that mandates vaccination? We're not necessarily going to weigh in to say you should or you shouldn't. It really depends on the workplace that you're operating within. But we are strongly encouraging that employers are mindful of other laws that are out there, privacy laws, human rights laws, labor laws, and that you're seeking advice when considering any sort of policy related to vaccination or mandatory vaccination in the workplace. There are people that may not be able to get vaccinated due to medical reasons, religious reasons, personal choice, or other. So there's lots of things that need to be balanced here with health and safety regulations when you're looking at potentially making those decisions. So I anticipate there'll probably be questions about this, and we can definitely talk more about it in the end. So this is what's required to be in place at all times. And again, it's not that this has to be documented other than where policies are required. It's more so about that you're practicing these ongoing measures related to communicable disease prevention. And then we talk about the additional measures. And we just recently had a great example of this. I'm sure all of you have heard about what's happening in Central Okanagan right now. And the fact that there have been orders put in place in Central Okanagan that have put back in place requirements for some of those COVID-19 protocols, primarily around the use of masks wearing in public places, indoor public places. So this is a good example where there is an escalation of risk due to outbreaks, the public health or medical health officers may issue orders, notice, or guidance, and it's responsibility of the employer to follow that. And that may include measures that would likely include measures that we saw during COVID-19 safety plans, such as physical distancing, barriers, mask usage, enhanced cleaning, disinfecting, modified worker transportation practices, or accommodation practices. So again, with the situation in Central Interior, we've mostly seen the order focused on the usage of masks within indoor spaces. But important that you're paying attention under step 1, what's happening, and that if orders are put in place, that you're following those orders. Step 3 is really a combination of step 3 and 4 within the COVID-19 safety plan. And this is around ensuring you've got the policies in place, and ensuring that you're communicating those policies to your staff, ensuring that all your workers know and understand the protocols that you have designed, that they're aware of the policies and practices, such as staying home when sick, or if you have folks working from home, what the work from home policies are, that you're posting signage and you're creating awareness around the protocols, that you're providing training for any protocols such as cleaning, disinfecting, and that you have appropriate supervision in place. So you're ensuring your supervisors are knowledgeable and that they are actually providing that supervision. And then lastly, just a couple points to consider, that this information should be provided to workers in a language that they understand. And then also just reiterating with the italicized text at the bottom of the slide that you should be mindful of privacy confidentiality issues as you are determining what policies you're going to have in place related to communicable disease prevention. Step 4 is essentially the same as what step 5 was within COVID-19 safety plans, and that's around monitoring your workplace and updating your plan. Recognizing that things change, things need to be updated. There may be pieces that work, pieces that don't work, gathering feedback from your staff, and ensuring that any orders, notice, or guidance are being reflected within your plan. So this is sort of your plan, do, check, act approach, that you're constantly monitoring the plan and updating it as appropriate. So fairly straightforward in terms of the 4 steps. The key point really being that those ongoing measures within step 2, that it is expected that employers will have that in place at all times. A couple other points here, really want to emphasize again, I talked about this during COVID-19, really emphasize the involvement of your workers. There's still a lot of fear out there with workers coming back into the workplace, what that's going to mean for them and the potential risk of transmission. They may have underlying health conditions, they may be caring for an elderly or a compromised individual. So there's fear in people coming back, and the more you can include your workers in the conversation, the more you'll be able to allay those fears. Now, this is already a requirement under the Act and the regulation around having, depending on the size of your business, having a joint health and safety committee in place or a worker health and safety representative. So that structure is already there, but we want to emphasize this, strongly emphasize, particularly during this time, the involvement of your workers in the conversation. Oh, excuse me. So let's talk a little bit about some information and resources available to you. What we have done on our website is we've actually removed all of the industry-specific protocols. So if you've gone to our website since July 1st, you'll notice that those industry-specific protocols we had listed for COVID-19 are no longer there. And that's because we're moving away from industry-specific COVID-19 plans to more generic communicable disease prevention that applies to all workplaces. So what you'll see now is this page, which you see in the image here, step 3 of BC's restart plan. It's much longer than just what you see on the screen here, but we get into really everything that I've talked about already today, as well as links to many resources, frequently asked questions. And we are constantly keeping this up to date, particularly the frequently asked questions section of the website. That is being updated daily, weekly, to be able to reflect the questions coming into our prevention information line and the questions we get in these webinars and so on and so forth. So I do recommend that you take a look at our website and regularly go back to it to see what additional information might be available for you. A lot of the resources that we developed during COVID-19, the posters and the guidance documents, those are still available. And what we're doing is we're transitioning the language within those from COVID-19 to communicable disease prevention. So you'll still find resources related to ventilation, hand washing, posters for occupancy limits, posters that encourage workers to cover their nose and mouth when they cough or sneeze, how to use a mask properly, how to choose the appropriate mask, how to wash your hands appropriately, stuff like that. So lots of great resources available on our website. We've also developed a guideline. Now, if you're familiar with the way that our regulatory structure is put in place, we have the Works Compensation Act, which is sort of at the top of the health and safety structure within the province. Then you have the Occupational Health and Safety Regulation. And then under the regulation, we've got policy and guideline that help to support the regulation. So when I talk about this guideline, this is a specific guideline that we have geared towards Section 21 of the Works Compensation Act, which is the general duties clause for employers, that speaks about the expectations of communicable disease prevention. This became effective on July 1st with step 3, and it clearly outlines what the expectations are for employers. So if an officer was to come out and do an inspection related to communicable disease prevention, which I'll talk about a little later, this is what would be expected, is what's within this guideline. This is what they're going to be looking for. And again, it's not a documented plan. It's around that you're practicing those things that I talked about earlier. And that's just really outlined in further detail within this guideline. And then I also just need to mention that the importance of paying attention to other health and safety risks within the workplace, that you're not only looking at communicable disease prevention. There are many, many other risks that will lead to serious injury, disease, and death within the workplace, and that you should not be taking your eye off the ball, whether it's falls from elevation, safeguarding of machinery, motor vehicle incidents, lots of risk out there in the workplace that employers need to be continuing to pay attention to. So some common issues and questions that I thought I would cover off. Worker abuse is a significant one, and particularly for many of the industries that you would see within the Whistler area. A lot of it focused on tourism, hospitality, restaurants, retail establishments. Like we're talking about a resort destination where it is about that interaction with the public. And what we've seen throughout COVID-19, what we're continuing to see through this transition is that there are a lot of people out there that are unfortunately being verbally and physically abusive to workers who are just trying to communicate or I don't want to say enforce, but at least maintain the protocols that the employer has in place. So if you work in an industry where this is a possibility, essentially that you are customer facing with the general public, you really need to ensure as the employer that you have a violence prevention program in place and that you've provided the appropriate training to your staff in how to handle those situations that may come up. So very important. This was already a requirement prior to COVID-19, but we are emphasizing it because of what we have seen over the last 12 months, where there has unfortunately been some members of the public who have decided to become verbally and physically abusive to staff and workers and others. Mental health being another key aspect for employers to be focusing on. This has been escalating significantly over the last couple of years, not just related to the pandemic, but otherwise, and emphasizing that employers need to be focusing on psychological health and safety and recognizing it's just as important as physical health and safety. So we've got some resources that we've developed, a guideline for employers and a guide for workers related to mental health during the pandemic. There's also lots of other great resources that are linked here on the screen. You'll all have a copy of this PDF PowerPoint afterwards, and you'll be able to link to these other organizations and the resources that they've developed. And then last in this section is just around working from home. And some employers, we're hearing from many employers actually that are going to maintain the working from home protocols. We're looking at doing that at WorkSafeBC, going to a hybrid working environment coming out of the pandemic. But where you are going to have your workers continue to work from home, understanding that your responsibilities as an employer still exist, and the health and safety of your workers in the home environment is still your responsibility. So having a policy in place around working from home is important, and that would cover off at least what you see on the screen here. Hazards and risk assessments in the home office. We're not saying that you as the employer need to go out and do that hazard and risk assessment. There's probably privacy issues there going into your employees' homes. But we have templates on our website that can help the worker go through that and then have a conversation with them over the phone or over Zoom to ensure that you're doing your due diligence. Looking at evacuation procedures and making sure those are in place, emergency contacts. Ergonomics obviously is probably the primary area for injury to occur in the workplace. I'll talk about that in a moment. Education and training, check-in procedures, so on and so forth. So we've got lots of resources available for you. This is a great run. This first link here under WorkSafeBC resources, how to make your computer workstation fit you. An excellent resource for employers and workers to help set up your home office, help set up the computer working environment to minimize the risk of musculoskeletal injuries, which is really outside of those emergency situations is really going to be the primary area of concern. Focusing on things like breaks and micropauses and taking, standing up from the computer, every 20, 30 minutes to get a bit of a break is really important throughout the day. We've also got some other resources linked here on checklists that you can use to be able to do that home office or home environment inspection. So some frequently asked questions, and we'll open this up in a minute for further questions. I've spoken about all of these already. So, the first one, do communicable disease prevention plans need to be written, documented, or posted? The answer is no. I've spoken about that. Can employers maintain COVID-19 protocols that they choose? Yes, absolutely. You can maintain all of your protocols if you want. And in fact, it's recommended to maintain those that don't negatively impact on your business operations. Will masks be required? So right now, other than the central interior, the central Okanagan, where we have seen mandates put in place, there is currently no requirement for masks to be worn. They are still recommended for indoor public spaces for those 12 and older who are not yet fully vaccinated. And fully vaccinated means 14 days after receiving your second dose. But also recognizing that people may want to still maintain wearing those masks. And we need to respect that. We need to respect all workers and the public who may want to maintain some of those protocols themselves, and recognize that everyone's going through this at their own pace to a certain extent. Are there industry-specific protocols for communicable disease? No, we've moved away from industry-specific protocols and gone to more generic protocols that apply to all workplaces. And then just talking a little bit more about ventilation. So where can employers get more information about ventilation and airflow? We've got lots of resources available on our website for you. If you do have questions specifically about your plan and how that's working within your working environment, I highly recommend that you call our prevention information line. Our officers we're taking a consultative approach as an organization. Our officers are not out there doing inspections and writing orders, except where needed. We are, as part of our regular inspections, we are asking about that transition to communicable disease prevention, seeing if the employer is having any challenges, helping with those challenges. Our officers doing that. I've got my team of OHS consultants making phone calls, connecting with industry, and helping employers as best as we can. But if you have a question, you don't have to wait for us to come to you, because we're not going to get to all 250,000 employers in the province. Give us a call our prevention information line. We're answering the call within 30 seconds, usually providing a complete response within an hour. You can speak to an officer, ask questions. We're taking, again, a very consultative approach. So there's some phone numbers there at the bottom of the screen that I recommend you give us a call if you've got any questions. And then lastly, you're more than welcome to email me if you've got any questions on my presentation today. I can guarantee my response rate is not 30 seconds, but I will do my best to get back to you as soon as I can. I've also included our general inbox for my team on consultation services at WorkSafeBC.com, more geared towards industry associations, setting up webinars, doing things like this. But you are welcome to email us there as well. If it is specific to you as an employer and your communicable disease prevention plan, we may forward you on to the prevention information line. So I do recommend that that would be your first point of contact if you've got questions about your plan or any challenges you're running into. So with that, I will stop sharing my screen and we can open this up for any questions or conversation that people might have. So Diana, maybe back over to you.
Thanks, Chris. I'm madly taking notes as we went through, but just to kick off the questions, one of the things that you comment on, and it's set out in step 1, with the practice being put in place in step 2. And one thing I think as business owners, especially right now in Whistler with the high amount of visitation that we're getting, is time is one of the scarcest resources, assuming your supply chain is working well. And I'm looking for some of that guidance from you as to what are some of the things that operators, managers can be thinking about around emerging risks, sort of that week to week, as opposed to waiting for an order and having to react to it. So what are some of the things that we should be thinking about to keep our eye on emerging risks and adapting our workplace practices? Flu season's coming up. We're grateful to have a very high vaccination rate in Whistler right now, but guidance that you have for us would be great.
Yeah, it's a great question, and it is challenging. It is challenging because even for us at WorkSafeBC, we don't necessarily know what decisions the PHO or medical health officers are going to make until they've made those decisions and issued the orders. Even with what happened in the Central Okanagan, we had very little lead time on knowing what was going to happen. But there are some indicators that things might be happening, and Dr. Henry talks a lot about those indicators that they're using to be able to transition through the various steps from step 2 to step 3 and then step 3 to step 4. And it's based on the vaccination rate, the hospitalization rate, and the overall count. So when we can see on a daily basis, we're still getting news releases on what the count is in the province. And we can even see that broken down by health region. And then you can also see what at least what the fatality rate is. I think hospitalizations is usually included in that as well. And then we know the vaccination rate is actually very high at this point in time. So we're quite happy with what we're seeing with vaccinations. But employers, again, paying attention to what's happening with the numbers and saying, okay, well, if we start to see this steep increase in the number of cases province-wide, the number of cases within a certain health region, and the number of hospitalizations, that's going to be a potential indicator that over the course of the next days to weeks, we might see additional protocols being put in place. So then it's paying attention to those numbers, but then almost anticipating that if there was an order put in place, what are you going to do as the employer to implement as quickly as possible? You know, I won't make any guarantees here, but it's pretty safe to say that those protocols that we saw during the height of the pandemic is what we would likely see in those orders. Maybe not all of them. As we saw with Central Okanagan, it was really focused on that mask wearing in indoor spaces. But being ready for that and not throwing away your COVID-19 safety plan, keeping it front of mind and saying, okay, well, if there was an order to come out saying that I needed to enforce physical distancing, or I needed to enforce barriers, put my barriers back up, or I needed to have a mask policy in place again, that you're not then at that point hunting around to find, well, where did I put those barriers? Or hopefully you didn't necessarily throw them out. I would suggest maybe hanging on to them for a while here, just in case. But being able to react quickly, saying, okay, it's all those what if scenarios. If these protocols get put back in, how am I going to react to that in a very short period of time so that I can still keep my business open and I don't risk being closed down? So it is about anticipation, paying attention to what's happening and being ready to implement those protocols that you had in place during the pandemic.
And that goes back a bit to what you were talking about early on, where if there is a practice that was put in place under the COVID-19 safety plan that doesn't impact the operations of your business, perhaps do keep it. You know, I know in one of my businesses, we've kept up a lot of the barriers, and as much as people want to take it down, I don't think I have the storage room to store that much plexiglass.
Well, fair enough. Yeah, fair enough. That could be a challenge. It's easier said than done on what you're going to do with it. But you know, for me, my experience in going out and I was actually in Whistler on the weekend and going to businesses. Many of those businesses are maintaining, particularly the plexiglass barriers. You go into the coffee shops and there's still plexiglass up. You go into the restaurants and they're still being used in certain situations. So great. I mean, we would encourage that if it's not impacting your business, you keep doing that.
Yeah, and I did make a note of that, of don't throw out those signs.
Yeah.
I never made so much signs in my life. Just monitoring the questions here as well. You've talked a little bit about those cadence of updates, which is great, but as an operator, what should I be using as a cadence to just check in on those plans? You know, it's sort of once we get to, well, I've got the plan and I'm just going to keep using it, and forgetting about it. And this isn't about forgetting about it. This is about keeping it alive. So 2 questions on that then. What's the cadence in which operators should be revisiting some of those protocols and practices? You mentioned, you know, doing your own inspections as an operator to make sure people are following it. And maybe I'll stop there and let you answer that one, and then I'll have a follow-up on it.
Sure. Yeah. You know, and it's, you know, I'd love to be able to say, oh, the cadence should be every 2 weeks. And it's not really that simple, because it's going to depend on your business. It's going to depend on how big your business is, how complicated your business is, you know, how many facets of your business might have different aspects to it. And, you know, maybe I can throw out a couple. Well, actually, before I get to the examples, I think, you know, it's also going to depend on where we're at. Right up front, as you're implementing that communicable disease prevention plan, there's probably going to be questions and feedback coming from staff, and like maybe things that aren't working, maybe the way you thought they were. So your cadence might be every few days. You just want to, you know, do a quick check-in with staff. Hey, we just implemented this on Monday. It's Thursday. How are things going? Or, you know, at least, you know, maybe once a week to start off with. And then as time goes on, that cadence will probably reduce to the point where maybe you're only checking in once a month. You know, when you're 6-8 months down the road, maybe you're only really doing that once a month check-in. In your monthly staff meetings, you're saying, hey, on communicable disease prevention, anything we need to be updating. But then there's the other aspect of that, which is, again, related to step 1, where you're monitoring the information coming out from medical health officers or the provincial health office, where anytime there's a change, that's an opportunity to be revisiting your plan. Even if orders aren't being written, anytime there's a change in direction, a change in recommendation coming from the PHO or the MHO, that should be a signal to the employer to say, okay, well, let's go back and look at our plan and just make sure we've got that covered off. You know, if there was a recommendation to, you know, we're really finding that, I don't know, whatever protocol name the protocol. That protocol was really working well, and so we're recommending that employers do X, Y, and Z. Then that's an opportunity to go back and revisit it, even if it isn't in order. But then when I think about, it's going to be different for every workplace. If you are in an office setting and you work in a particular business where you don't really have the public or other people coming into that office setting on a regular basis, maybe you're a law office and you're doing most of the work virtually, as an example, there might actually not need to be a lot of change to your plan. You put your plan in place, you communicate it, you check in with staff, and then it stays fairly consistent. But if you're an operator like let's use maybe a large grocery store as an example, where you've got that front-facing side of your business, where you've got the public coming in on a regular basis, and then you've got sort of the back end side of the business where you've got your finance and accounting and HR and those groups that may not have a lot of that public interaction. You may actually have different frequencies for each of those groups. Where that office group, you may be able to put in some protocols and keep that fairly consistent, but for that front-facing group, you may need to be doing that check-in more frequently depending on the time of year. This time where you've got a lot of tourists coming to Whistler and it's really busy within those stores, you might be doing more frequent check-ins as opposed to the shoulder seasons or off seasons where you don't have, stores might not be as busy. And then another example would be a small tourism operator, which I know is obviously very apparent within the Whistler area, where you might be offering various types of tours. And I'll just throw this out there. You might have like an aspect of your business that does helicopter tours. You might have one that does, snowmobile tours or wildlife tours, in Jeeps or whatever. Like, I don't know. I think you get what I'm saying, that you might have to have a different cadence of reviewing your plan based on the different types of operations that you're doing. If you're out doing a hike, and you're a tour operator doing a hike and everyone is sort of spread out on the trail and there isn't a lot of that close interaction, your plan might look a little bit different than if you've got everyone crammed into a helicopter or everyone crammed into a Jeep, you know what I mean? So it really does depend on the operations. And it's going to come down to what the employer feels is going to be good for them. But what I would strongly recommend is that, particularly up front, I would say at least every few days to every week, you're doing a check-in with staff just to say, hey, what's working or what's not working, at least until people become really comfortable with what that plan looks like.
And that's that comment leads to that idea and the importance of the staff input. What are they seeing that you're not seeing? Where do they feel safe? Where do they not feel safe? How are you adapting to that? So that constant check-in with your team. And if you don't have a fulsome team, to put together a full health and safety committee, but just how often are you doing it? So I think that's important. And on that note, going to, and I appreciated that you included that psychological and physical safety of employees. I think the fatigue for a lot of employees is still there. So this idea of no more COVID-19 plan, this is, okay, phew. And how based on your experience, within the communicable disease, but also all the safety measures, how do you keep it alive for employees? How do you keep it top of mind without it being that mental burden of constantly having it said to you or thought about? So would love to just get some thoughts from you on that.
Yeah, again, great questions. I think for the employer, where workers in my experience, I guess I shouldn't say our experience, in my experience, where you're going to get that buy-in and that engagement and that energy from your staff is where you as the employer are demonstrating that you care about them. And so what does that actually mean in the context of COVID and communicable disease prevention? And to me, it comes down to that effort, that visible effort from leadership in creating that open culture of conversation and communication related to health and safety. And this doesn't just apply to the pandemic. This applies to everything in health and safety. And we talk about this constantly at WorkSafeBC, that it comes from the top. That culture of safety in an organization has to be led by the leaders, those who run, own own that business. Definitely you can build groundswell for sure, but if your leadership are not demonstrating their interest in health and safety, which means their interest in their staff, then it's hard to continue to maintain that energy and that buy-in. So not, for an employer not to dismiss what's happening and recognize, like for an employer to, I guess, sort of wear their opinions on their sleeves can sometimes be dangerous, if I can put it that way. That for an employer, if they felt, there's people out there that maybe haven't really bought into this whole pandemic and the level of protocols that have been put in place over the last year. If you as an employer feel that way, and at the first opportunity, you're taking down all your protocols and going back to normal, without considering that you may have some staff that are not ready for that because they are on the opposite end of that spectrum, then it could be quite damaging to your overall health and safety culture, your overall culture as an employer. So I think for an employer to really think about, before they react and before they start making changes, really think about how this might impact their staff. Now, again, that might be very different for an employer who has 2 staff versus an employer who has 500 staff, and how you approach that is gonna have to be taken into account, and how you get that feedback is obviously going to be very different in those extreme scenarios. But really encouraging employers to be open, have that conversation with their staff, show that you care, ask them questions, ask for feedback, and don't necessarily just come out and say, okay, I'm taking down all the protocols, this is what's going to happen. Now, you're right though, Diana, that the fatigue level is high for many people. And it is about balancing that as well, and trying to as the employer, trying to recognize where your staff might be fatigued, and maybe considering what they might need in order to get past that. And maybe and I know this is difficult for those small operators who, at the height of the tourism season right now are very busy, but, giving people a break, giving them, the time off that they need, a Friday afternoon off or whatever. I mean, it's obviously going to be different for every employer, but just recognizing where that fatigue might be occurring, and making sure that your staff are, checking in with them and just seeing how they're doing and offering them that support. And that support might be different for every worker, depending on their personality and their current situation.
Yeah. Thank you. It's good to be reminded of that, and I think you've given some great advice in there. I'm conscious of time, and we have addressed all the questions. I just want to make a point to our members and those that are watching this rebroadcast or the recording of this, that in preparing for our talk today, I did have a chance to go through a lot of the links that you shared today, that are available through the website and the different sites that you've referenced. And it's great that we'll have a copy of that for our members. And I encourage everyone to do that. I've kind of glossed over a few of the very technical FAQs because, as I said, the references that you have there in the website information is on point, and we'll address those. So I encourage our members to do that. So with that in mind, I may give back 10 minutes of your day, time also being one of those precious commodities that we all need. But I want to thank you so much, Chris, for taking the time coming here. I like that you did some research of Whistler before we had this call. So thank you for that, and thank you for your patronage. It's hard to believe it's been a month. Just over a month since we entered phase 3 of the restart plan. It feels like it was just yesterday, and yet it doesn't, because as you say, the visitation in Whistler has escalated very quickly. And I have thoughts for many of our resort communities across this province who are under threat of wildfires. And I want everyone not just to be communicable disease safe, but also hope families and workers across this province are safe. So thank you for your time, and thank you to everyone who has tuned into this, both during the live broadcast as well as the recording. It's been an invaluable and important webinar for the knowledge and reference of our business community. Our next upcoming event is the 2021 virtual Whistler Excellence Awards on September 16th. You can go to whistlerchamber.com to find out more information, and we hope that you all tune in as we celebrate the business community through 2021. We will continue. The Chamber team will continue to stay connected with all of you through regular e-news updates, and we will be hosting a few more webinars and soon to be in-person events to help you all stay updated. Thank you for your time.
Thanks, everyone. Take care.